my name is Moises Spindola. I go by Moy. I've been in HealthPoint since September of last year, and it's been a really nice ride so far. So I knew of HealthPoint since I moved to the area in 2013, and I noticed that there was one of the centers being built around that time, and I was like, oh, that's HealthPoint, okay, and that's community health, and it kind of went away. And then while looking for other jobs and opportunities, I noticed that HealthPoint was hiring, and then I read about the mission and how they're focused on people in the area, and I thought, well, I could do something that could help the people around me, and that's what drew me in. We have the opportunity to partner with multiple teams, so we are able to help depending on the needs and our availability. We're able to help all of the people in the organization. Our current projects, they span from applying a new tool, which is going to be our new system to be able to ask for PTO or going on vacation and checking your time card. But we also go into more personal learning that I like to call personal learning, because it's more about skills that you apply when you work with others, not just with tools or systems. Well, HealthPoint's mission is very inspiring, right? So we want to make our communities strong and make them healthy. But I also see in that mission, the strengthening is not just health, but it's making sure that everyone's got what they need to succeed and to be better, right? And strengthening in our community means many things, means education as well. So I see it as being able to support that mission locally as a very inspiring thing to do, as a very humbling way to approach someone's development or someone's support, someone's betterment. What excites me is that there's a lot of changes in how people learn from a technology standpoint. When we go back to the basics, it's consistent, but how we introduce new concepts, how we use media, how we use technology to be able to share and to be able to maximize the time that people use for learning and make it applicable and relatable to them is something that we have in mind all of the time. How do we connect with our audience in a better way? How do we ensure that the content that they're going through is easy to consume, but also highly relatable to their jobs? And that's one of the things that, even though we're removed from the day-to-day at the clinics, we always think of how to improve our content in a way that we remain, or in a way that we make it relevant, in a way that it's relatable, predictable, and repeatable, so that whenever they go back to their jobs, they are able to apply what they learn and continue to support their teams or themselves in a better way. Of course, anyone that wants to help their community, I think coming into a place like this, an organization like this, would be highly rewarding. I mentioned this in a few sessions that I facilitated, that I've not been in a place where the mission is as strong as it is in HealthPoint. Everyone is drawn to the mission, and everyone has a story of why they work at HealthPoint and how community health or health as an activity has helped their individual lives or their families. Being able to support that, even though removed from the front lines of healthcare, is very meaningful, because you're able to help shape good care for our community.